One opportunity that this pandemic presents for school-age children is teaching them what to do about their anxiety and teaching them emotion management skills. Across the board, we're seeing increased rates of anxiety and depression among younger cohorts, children and adolescents in particular. We are seeing, increased rates of anxiety, increased rates of depression. They're struggling with increased rates of loneliness because they're not able to connect with their friends from school in the way that they usually would, or outside of school, because there are restrictions around social distancing. We are seeing increased rates in younger people thinking about suicide. Fortunately, in most countries, that hasn't actually translated into them acting on those thoughts, which is a really good thing. We're definitely seeing that for people who had pre-existing conditions like ADHD or depression, that the environmental changes that we're going through right now have had a major impact on their pre-existing symptoms. We're also seeing new onsets. So for children who didn't necessarily struggle with attention or concentration or depression, we are seeing individuals who are struggling with that for the first time. At least in the United States, we struggle with being prepared for mental health services for any demographic. We are seeing a demand for mental health services like we've never seen before. School-age children are no exception to that. In fact, I think the challenge in access to mental health care is really even more extreme among younger cohorts. Even before the pandemic, there was a major access challenge with getting kids connected to mental health care. Given that we're seeing increased rates of anxiety and depression during the pandemic, I do think that schools are going to need to increase the attention that they have to helping youth to work with mental health challenges that come up. And I think that's a good investment to make well after the pandemic is over. I think we all need to learn strategies for managing our mental health at a younger age than we typically learn. I think it always starts with modeling healthy behaviors. So this looks like investing in your own self-care if you're a parent to a child, and making sure that you're in a good headspace to be able to be the kind of parent that you want to be, or the kind of teacher that you want to be. I think it also requires adults to talk with children about anxiety. The best investment that an adult can make in their child's mental health is to listen to what's going on for them and to offer, problem solving when necessary. But sometimes all they need is just a validating, loving adult who can make sure that they're seen in the world. Being honest with them about what's going on without making them, focus all of their attention on it, I think is important. It's all about finding that balance.